This portion of New Day Northwest is sponsored by the Polyclinic.
Hi there. When it comes to erasing years from the face, there are lots of alternatives to surgery. Here with three of the most popular options, please welcome from Polyclinic Plastic Surgery, Dr. Meghan Nadeau. It's good to meet you. How are you doing? Thank you for coming in. So I'm all ears about this. Let's talk about the various non-surgical options, because we've all heard about facelifts, things that are kind of major surgery. The first category is fillers. What does that entail?
So filler is used to kind of plump up the face. And a lot of people confuse this with Botox. I get that question all the time. But filler is really going to make you look a little bit more youthful. Actually, it's kind of interesting, but if you look at this before and after, she looks thinner in the after, where I've actually volumized her face, than she does in the before. So
tell me where the volume went. I mean, that's an amazing difference.
Thank you.
So where did you sort of poof things up?
Yeah, so you're really looking at...
Is that a medical term where you poof it?
It can be. So you're really looking at adding volume throughout her cheeks and kind of in that complex between the eyelid, the lower eyelid, and the cheek, and then also along the jawline and around the mouth. So she actually has no filler in her lips in this particular photo, but her lips look a little bit more prominent because we've supported the soft tissue around the mouth.
Isn't that interesting? And so the skin is kind of pulled upwards a bit just by the volume inside.
That's exactly it.
All for that. Okay, let's talk about Botox.
So Botox has become kind of a ubiquitous term. It's like Kleenex, right?
Yes, everybody thinks anything you're getting is Botox, right? We just use that like Coca-Cola.
Right? So it's really a wrinkle relaxer. So that's what Botox does. It comes up and paralyzes little tiny slips of the muscle that you don't need for movement, and that's what relaxes the wrinkles. So you can see this is a young patient, and you would say, oh, she doesn't need anything. And if you saw her, she's gorgeous. But really, she was noticing in photos that she had a lot of lines around her eyes. And so you just relax those lines. You can actually lift the brow a little bit with Botox, which is quite nice. It opens the eye. And then, of course, it's the usual things you would think about, like getting rid of the angry mom lines.
Right. I've earned those, I think. I'm not sure I'm ready to let go of them. So a question about Botox is, there is botulism in it, right?
Correct.
And so everybody was sort of freaked out when this first came out that this was some sort of poison you were putting in your face, but it's very safe, and people know how to use this perfectly now. Is there any advantage for a young person like that to begin at a younger age and not wait until wrinkles are more pronounced?
Absolutely. So when you look at a wrinkle, there's rest wrinkles, right? And that's where you make the same face over and over and over, and then the wrinkle doesn't go away when you stop making the face. And there's dynamic wrinkles. Dynamic wrinkles are just the lines that are made when you're actually moving. If you start Botox at a younger age, you actually prevent those rest wrinkles from ever forming.
Interesting. Okay, let's talk about something called Kybella, and I've heard this in commercials, but it is some sort of fat melting thing, which is genius.
That's pretty much it. So it's the same enzyme that your gut uses to absorb fat inside your intestine, and we actually just inject it.
And this is one of your patients, right?
Yes, this is my patient. This is me, and it's actually it's a very easy procedure. It's just a series of injections with a teeny tiny needle, a 30 or a 32 gauge. So that's smaller than the butterfly they use to draw the blood out of your finger.
So just a pinch.
Just a pinch.
And then in all those different places, right?
That's right.
And what does that do?
So it
rid of the double
dissolves,
chin?
Yeah, so it dissolves the fat, getting rid of the double chin. And what you see, and you can see in her picture here, is that it actually sculpts her entire jawline. So that's just one treatment, and that's 7 weeks out. So her final result will actually be at 3 months, and we may do a second treatment on her to get a more dramatic result. But it's indicated for this area right under the double chin, right? But you can also use it in other small areas like the bra fat. Also right above the knees is a favorite.
That's interesting. Okay, so all of these different things involve needles. Do they hurt?
It's like having your eyebrows waxed. So if you would avoid having your eyebrows waxed, then maybe you would avoid Botox or filler. But all of these medications have an anesthetic in the product itself, and so it's really no more than a teeny tiny bee sting.
No big deal. And recovery time?
Recovery time from filler, you can bruise, and that's the thing that we worry about the most, but other than a bruise, that's really it.
And the bruise is going to go away. It's just a tiny thing, right?
Exactly.
Okay. And are you seeing as many men as people talk about, that there are more and more men coming in for these things? Refreshing themselves?
Right. I still see a predominance of women, but I am starting to see more and more men start to dabble a little bit. And usually they start with Botox, but I'll tell you, filler in a fit male can be very powerful. Now, you don't want to overfill them because you don't want to feminize the face and smooth it out too much, but when you add a little bit of cheek, you know, if you're very fit, unfortunately, as we stay fit and get a little bit older, we lose that volume and it makes us look tired. And so if you revolumize that, they look really youthful and really vigorous.
That's very interesting. Thank you very much. I love just talking about it. I feel more vigorous myself. For more information about facial rejuvenation and other services offered at Polyclinic Plastic Surgery, please visit the website. They're listed on your screen, and you can find links on New Day's homepage as well. We'll be back after this.